I'm going to be talking to Professor Ubaka Ogbogu. He's the Katz Research Fellow in Health Law and Science Policy at the University of Alberta. And we're going to be discussing the performance of Dr. Deena Hinshaw, who is the Chief Medical Officer of Alberta, and her role in pandemic management during the COVID-19 crisis pandemic. So welcome to the interview, Ubaka.
Thank you for having me.
Well, look, I interviewed Dr. James Talbot, who's the former CMO of Alberta, and he described Alberta's pandemic management this way. First wave was fine, was very good. Second wave was okay. Third wave was poor, but some last-minute interventions by the Alberta government avoided a crisis. The fourth wave, which Alberta is in now, is an utter disaster. I don't think anybody can argue against that. So the question I'm posing to you, sir, is what role, how much responsibility does Dr. Deena Hinshaw bear for the situation Alberta finds itself in?
Well, that's a very complex question to answer. And I think the answer will be different depending on if you're asking somebody who's an insider, somebody who has insider information, or if you're asking me, who obviously is somebody who's on the outside looking in. But based on publicly available information and what I've had access to, I would say that Dr. Deena Hinshaw shares a huge part of the responsibility, a huge proportion of it. I'll go as far as saying, if people are blaming the premier for this, she has an equal amount of responsibility. But because she has positioned herself as the advisor to the government and the person who supplied the scientific information or basis for that decision making, I would even say she shares a greater proportion of the responsibility.
Well, let's talk about some of the mistakes that she's made. I mean, there are some systemic mistakes, I think you could call them, such as resisting the science around the airborne aerosol transmission of COVID-19, which is still ongoing. Other provinces and other jurisdictions in the world have accepted that, and it makes a big difference for pandemic policies. But the really big one, I think, is the error that she has admitted in the modeling that they did around the fourth wave COVID projections or infection projections. So we remember that they used UK assumptions which were entirely wrong. They should have used assumptions based on the southern US. And that led to her supporting the idea that the pandemic was over. We were into an endemic management phase. And that proved to be entirely wrong. And it led to where Alberta is now. I mean, that argues for her being, I don't know how else to put it, but directly responsible for the fourth wave.
I agree. I think that was a big one. But another big one is the fact that she also ended the test tracing and isolating that was going on. Those are basic public health measures that should exist at all times. We should be doing disease surveillance, and we should be making sure that persons who are infected in the community, it doesn't matter whether it's COVID or some other disease, if it's infectious, a chief medical officer of health has a responsibility to make sure that people who are infected know to stay home. So to do that, and we haven't recovered from that up until the present time. They're still very, poor testing measures. The tracing measures are not very good. People are not really isolating because the government is not really encouraging it. It's not happening, for example, in schools. So those two mistakes, the mistakes around declaring that we're in an endemic state and then ending the test, trace, and isolate measures, to me, suggest strongly that she ought to resign. I mean, if she had any integrity, if she actually believed in the office of the Chief Medical Officer of Health, she would know that those mistakes are very fatal and they've led directly to the fourth wave. So she ought to resign. She shouldn't even wait to be fired. If I was in her position and I made that bet, it was a very dangerous bet, and it was a bet that people want her not to take. If I made that bet, I will simply know that I've proved incompetent for the job, and I'll resign my position.
There's another thing, well, she does this all the time. And it basically, she stands up and she carries water for the provincial government. Now, I've interviewed Professor Dwayne Bratt about the politics of the Kenney government and why they have mismanaged the fourth wave so badly. So we know that there's been a huge policy failure in the cabinet level and the premier's office, but she stands up and carries water for that, and that, I think, she doesn't speak out when she has a voice that would be listened to publicly. That is a major failure in my view. What's your take on it?
So that's a much deeper problem with this government, and I think she's just caught up in what is a problem with the government dismantling independent institutions and basically taking control over civil society institutions and all kinds of public institutions, including public offices. You'll recall that I resigned from the Health Quality Council of Alberta for the same reasons. This government does not want public institutions, to work for the people. They want public institutions to work for them and for their own political ends. And this is not the first time that Dr. Deena Hinshaw has, as you said, carried water for the government. There was a report in the CBC last year about how she did that, I think, with respect to the second wave, where she had scientific advice that she was trying to give to the government. They were not accepting it. And instead of, actually giving that information to the people and coming out publicly, she instead decided not to do that and allow the government to have their way. So with respect to this fourth wave, that's essentially what she's done. And I think if the gamble had paid off, we will never know. But, of course, it didn't pay off because everything has now gone sideways. That's how we now have information as to the extent to which she had been obscuring access to information that will allow us to scrutinize the government and that office. So I think part of me feels like it's the way that this government approaches how they deal with public institutions. As you recall, from the start of this pandemic, the government has insisted, or first insisted, that she was an advisor to the government and she didn't have any independent powers, which is contrary to what the Public Health Act actually provides. She agreed with that interpretation and has been parroting that interpretation on behalf of the government, which is a big mistake on her part. And then when things went, sideways, the government then said, well, it's Deena Hinshaw, she told us what to do, and we followed what she said, making us seem more independent. So there's been a ton of confusion, and she hasn't helped to clarify that confusion. Now, let me be very clear for the benefit of your viewers. Dr. Deena Hinshaw actually has independent authority under the Public Health Act to do a lot of things to manage this pandemic. The fact that she has abdicated her responsibility to me is also on the basis for her to resign. Now, that's not to say that the position is not one that can be influenced by the government. And of course, the government can fire her if she refuses to do what they say. But I'd like for public officials to actually have some integrity and understand that if the government is using political reasons to stop them from doing the jobs that they have been appointed to do by the people of Alberta, resignation is not a bad option because it signals to the public that the government is interfering.
Yeah, that's a really good question, because I've interviewed you before about, I think it was Section 29 of the Public Health Act that gives her the power to operate independent, to make decisions and implement measures to protect public health that are independent of the government. She doesn't need Jason Kenney's permission to do those sorts of things. She's chosen not to. Now, in fairness to her, Dr. Talbot did say that's kind of the way the job has been administered or perceived over the years, as an advisory as opposed to being active. But on the other hand, when the crisis is this deep and she has those powers yet chooses not to use them, is that not a moral failing to stand by quietly and to watch a system fail that leads to such suffering and death?
I believe so, and I have said this multiple times. And I question this notion that that's how the job has been perceived. No one will say to the Auditor General, for example, that we perceive your job to be one where you're subject to the government. We understand that that job is one that allows the Auditor General independence because of what the Auditor General does. And I don't see why somebody who has to manage a pandemic or disease in our society should be different. If the legislation says you're independent, you're independent. What you ought to do is work with the government. But if they're impeding you, then you ought to disclose that and step aside, right? And look, I recognize that in practice, this will be difficult to achieve. But at the same time, it hasn't helped Albertans that she has decided to become an advisor to the government. We have ended up in a position that is far worse than Dr. Deena Hinshaw saying, I resign. I can't work with a government that is impeding what I'm doing, so I'm going to step away. So I think it's a moral failing. I think it's a lack of integrity. It's a lack of sort of the strength and will to serve according to your statutory responsibilities and duties. And it's a feeling that I see across many government institutions. People just think that, I hear this argument all the time. If I stay on, maybe I can help from the inside. Another version of the argument is to say, if I go, they will appoint someone worse. I just find those things to be nonsensical, to be honest. If you have a job to do and the government is not allowing you to do the job for political reasons, resign. Send a signal to the people that the government is impeding you, and the people will act accordingly to hold the government to account. Don't cover for them.
So at this point, Ubaka, Alberta is in full-blown crisis, and I guess some would argue that this is a bad time to switch horses, at this point in the race. But I guess the other side of the argument is that if horses are not switched, it just will what's the fifth wave going to look like? What will the latter part of the fourth wave look like? It can still get much worse than it is today.
So, that horse is dead. It can't get any worse. Dr. Deena Hinshaw is at this point has proved completely incompetent. All the advice that she gave has led to a fourth wave. So I'm not even saying she should resign because she's not carrying out her statutory duties or because she's pushing herself as an advisor. I just think she's received a failing mark with respect to what a person in her position should do. And, if you drop the ball this badly, I don't know of any job where you'll drop the ball this badly and retain your position. Staying on there sends the wrong message that you can actually be a failure and be the chief medical officer of health of Alberta. So I think the proper thing to do is for her to go, and the government can appoint someone else. They can even appoint someone who, people think is worse than Dr. Deena Hinshaw, but it can't get worse than this. Right now, it's counterproductive for her to be in that position. Her colleagues don't respect her. People are not listening to her. I don't take her advice. I don't see her as somebody I respect. I don't see her as somebody who should be giving advice to the government on these matters. I think she's got the science wrong. I think she's following the Great Barrington Declaration, which is completely wrong-headed for somebody who's supposed to be a scientific officer of health. So for all these reasons, I just think it's time for her to step away. And again, let's worry about the new appointee when we get one. These same things were said about Minister Shandro. And now that Minister Shandro is gone, we don't have to deal with that incompetence anymore. We now have Jason Coppin. And we can assess Jason Coppin on his own terms. I may not like his politics, but I don't have to deal with Shandro anymore because Shandro was just grossly incompetent.
Well, on that note, Ubaka, thank you very much. Always appreciate your insights.
Always a pleasure.